Hello, I'm Jonathan Colopy from Year Y. Welcome to Be Well. I'm very fortunate to have these conversations to foster a mindful lifestyle of well-being. Today's topic is successful aging. Our guest, which I'm welcome to invite and introduce, Dr. Katrina Deleon. Dr. Deleon is the division head, Scripps Clinic, Torrey Pines Division of Geriatric Medicine and Gerontology. And we're going to find out what all that means. So, Dr. Deleon, thank you so much for offering yourself for this conversation.
Thank you so much for having me. I'm excited to be here and talk geriatrics.
So there's a lot of conversation. Maybe it's because baby boomers are getting older, and therefore there's more attention to how do we do it successfully. I remember reading a book, something about being younger next year, and it was giving a prescription how we can age gracefully. And so this is our conversation today. So how do we start off when we're talking about geriatrics? What is most important as we age?
Oh, I love that question. So before I get to the answer about what is most important about aging, because there are several pieces and you can go down any different line, but what you mentioned about baby boomers and why is this on everybody's mind right now is because this is a time where the population who is over 65, so I guess technically between 1946 to 1965, if you were born between those years, that is larger than the population that's younger than people being born. And so in terms of provision of services, being healthcare providers, this makes great strain on the pre-existing resources. And speaking as a geriatrician, so I'm internal medicine trained and did my geriatrics fellowship, and there is just not enough of us to go around. And what our hope is to teach people, not people, patients and people who provide services and people who do things like this, like your wonderful podcast, how can we get the mindset and the skill set of thinking like how a geriatrician would think, because there's not enough of us to go around. So what are the keys to successful aging? Is that the initial question?
That's the question. And I just want to say that is a remarkable statistic in terms of this demographic is larger than the amount that is being born. And so I think at the Y, we are as well looking at how do we make sure that we have programs and services to best meet those particular needs. But yes, how do we do it successfully?
There is no secret potion, just so you know. There's no magic, youth fountain that people thought existed. But what I can say, and I guess I'll give full context, I'm a SNFist, so I work in nursing homes or skilled nursing facilities. And so my usual patients who come to me aren't typically always dwelling in, very active and successfully living in the community necessarily. Sometimes these are patients that are institutionalized. These are people who are going into the hospital, getting to a nursing home, coming back around, because usually the only way that you're getting into a nursing home is after the catastrophe, after the crisis. There are a lot of patients that have the accident, right? They have a fall, they break a bone, they get hospitalized, and then they're temporarily at a nursing home under our care. But that's the context that I'm going to kind of speak to, because this is crisis emergency mode. And I fully understand that, there are so many older adults and people who want to age without ever having seen me as a SNFist in the nursing home.
Well, that's why it's so important that you're offering this information, because if I have to get hospitalized to get this information, I don't know. So I'm taking notes here.
Okay, perfect. Yeah, because that is actually, unfortunately, that becomes the problem is you get caught off guard, and then it is the first time you're ever having this discussion isn't with your primary care or with somebody when you're in a healthy state of living. It's under duress, it's under this crisis mode, and I'm hoping to avoid that. So how to think like a geriatrician. I would say in terms of successful aging, we like this 4M's approach. And so these are 4M's, and the first one is what matters most, because geriatricians say when you see one 80-year-old, you've only seen one 80-year-old. It's so heterogeneous. There's so many different things, so many different factors. Age is nothing but a number. So focusing in on what matters most to this individual that's in front of us is the tenet, I'd say, for geriatrics. And that's how your medical team should be managing and sort of North Star going to, is what matters most.
That's
The next,
wonderful to hear that orientation, that patient-centric model. So yes, thank you.
perfect. And then, so the next M would be medications. And so as we know, medications are the main tool that doctors have, right? If you've got a problem, if you have a medical condition, a lot of times we're prescribing medications. And so as we get older, what we see in the research is, number one, a lot of our exclusion criteria in research is age over 65. So you're essentially excluded from a lot of the studies that these medications are based off of. So polypharmacy becomes an issue. And so polypharmacy is one of it's this concept of, if you've got more than 3 or 5 medications, you're really in this polypharmacy world. And a lot of times things like a heart attack or a stroke automatically get you into polypharmacy. And so a geriatrician really likes to think of, what is it that we're treating? Because by the time you get older, there's a lot of times there's multiple conditions that are going on at the same time. And how is that serving you? Is this a medication that takes 10 years to derive a benefit? Or is this a medication that it takes 6 months to derive a benefit? And is this medication's side effects causing other side effects that another medication is on to treat? So deprescribing and medication optimization is something I think is really helpful for people to kind of advocate for themselves, because there are a lot of supplements and nutrients and things that are not necessarily from the physician that you should let your doctors know about, so that we can make informed decisions about the medication management.
It would seem like that would be a large percentage of older adults that are polypharmaceutical. Yes, but just because of various conditions that develop throughout time. So are you saying the family physician is the one that should be managing the whole context of all that?
Absolutely. I'd say primary care physicians, especially the way that healthcare, the model has become, whether it's a family medicine doctor or whether it's your internal medicine doctor, sometimes certain subspecialists turn into that doctor too. So like, for example, nephrologists, or in case of women, sometimes the OBGYN becomes that person too. So whoever is your trusted doctor, or the person who's kind of managing the most of your care, I absolutely recommend medication reconciliation. Have your whole list up to date and bring that with you when you're seeking care, because it becomes fragmented, and we want to be able to optimize, deprescribe. I say optimize because typically it's deprescribing, and taking off medicines is always the goal. But we also realize we need some of those medications, and they do save lives and they do decrease mortality. So figuring out which ones are the most important.
Great. So that's 2 M's. It seems like we have a couple more that you're going to bring through.
Yes, absolutely. So the next one I would say is mentation. And so this kind of goes into how are we assessing your cognitive state? And cognition is multifactorial. So in terms of the older adult population, one of the biggest things is dementia, concerns for dementia, delirium, which is a temporary state or a confusion that usually is caused by something. Like, for example, if you have too many pain medications after an operation, you can get confused in that state, but it's temporary. It's reversible, because if you stop the pain medications, you could potentially clear that delirium, or if you get an infection that causes something that's a temporary state. And then otherwise, if you're talking about assessing mentation, how is your memory overall? Are you in a cognitive impairment state? Are you in an Alzheimer's state? Do you have dementia due to vascular disease, heart attack, strokes, things like that? This is important, because if you don't understand that piece, you're not able to sort of you need to get the other people involved. You need to have the support system involved, because if you don't have that ability to make decisions, or if you don't have that ability to comprehend and understand everything that's going on in your healthcare, we need to incorporate other people, or incorporate your loved ones.
Dr. Deleon, so what would prompt me to have someone do an assessment in that area? Do you know what I'm saying? These are really important pieces, but I'm just trying to think, when would that get activated, that someone is looking at those things?
That's a great question. So unfortunately, it gets activated too late, too often. A lot of times it's by the time people are losing the ability to perform sort of activities of daily living, where it used to be, oh, mom forgot this or a name or this person, or their forgetfulness kind of in regular day-to-day life. But then when it gets to the point where, mom's forgetting to pay her bills, mom forgot to pay the mortgage and these financial pieces, or mom wore a tank top and it was outside, we were, out in snow. When activities of daily living kind of get involved, I would say that would prompt, but it's too late.
Yeah.
Ideally, we catch this beforehand. So these should be screeners from your physician's offices. And a great one is to go, if you're 65 and above, there is an annual wellness visit that Medicare has. And that is a perfect time to get your doctor to talk to you about these screeners. And there are certain tests that they can do to at least catch if there's potential for any kind of dementia or.
That's a really important point, because I'm thinking that if I'm challenged with some of these things, I'm not going to maybe recognize it, or I might be in a bit of a denial, but my partner or somebody close to me or a family member will. But noting that there's that free wellness visit that can happen at 65, that's a great checkup.
Perfect. Yes. And so that's definitely one piece of it, is just the cognitive assessments. But then how are you doing emotionally? Are you having depression? Are you having anxiety? Are you having a lot of loneliness? What is happening from your emotional state? That also goes into mentation, because there's even a term called pseudo dementia, where you would present as though you have these memory impairments and these dementia-like symptoms, but it's just that your depression is so out of control that it's presenting the same way in a person. And when you're treating the depression and you're treating the mood piece of it, then the cognition improves also. So that mentation is kind of all encompassing. It's got a lot of factors to it, but at least getting some of those assessments on. And same thing with your primary care. For depression, it's called a PHQ-9 or PHQ-2. So you might have that whenever you're just going to your routine doctor's appointments. But I would say, ideally, the healthcare system is screening and catching. But if you ever feel that you're having any of these symptoms, always bring it up to your doctor.
That's excellent. It's important that you're making us aware of and empowering us to seek that information out. Was there one more M? Is that the?
Yes, there's one more M, and this one's actually my favorite M, because this one's called mobility. And so this is a place where the Y, and I'd say our physical therapists and occupational therapists, and this is all about your physical mobility. This is your functional status, is another word that we use for it. And at the skilled nursing facilities, so at these nursing homes, a lot of our patients, we have two populations, but one population is that they live there. This is their home. But the other population is after you had a hospital stay and after you have a lot of weakness and decompensation after having, a crisis in the hospital. This is where mobility is where we actually get to see a lot of improvements. And in terms of preventative pieces, I would say for mobility, knowing that falls is one of the biggest contributors to why people as we age end up getting hospitalized, and then that it doesn't get as much press as heart attacks and strokes, to be perfectly honest. And it's the majority of our practice is someone was doing an activity and they were living their life in the community and they fell and then had some sort of injury, whether it's a laceration or a cut or a bruise, or if they broke a bone, a hip, a knee, a femur, had to get surgery, thinking about that is a possibility, and then that there are dangers associated with that. I mean, one of a fall with a hip fracture that actually affects your lifespan, essentially. Like the statistic is that almost 20% of people after they've fallen and broken a hip, 20% mortality, as high as that after a year. So I know it's
I'm just very aware, just anecdotally, people that I've seen, friends of ours, and even my own parents, that as they got older, if they had a fall, just the impact, and it wasn't like they rebounded from that often. It just it led to a certain decline in terms of their health overall. And I recognize just how important mobility is in terms of enjoying your lifestyle.
Yes, exactly. And thanks for bringing that piece up too, because that is preventing that first fall is probably one of the biggest things that you can do for your health and to be able to successfully age, because that story does go on that, okay, after that first hospitalization, you fell, you broke your hip, and you got back to almost your prior level of function. Like you're able to walk maybe with a walker or an assistive device, but you're not quite getting all the way back to where you were. And there's this concept called homeostenosis, not homeostasis, but homeostenosis, where we essentially, as we age, it's not that these conditions get us whenever we age, it's that we lose our reserve. So something that would have, if I fell and broke my hip as a 30-year-old or a 35-year-old, and then I get my bones recover, I'm able to kind of compensate for that fall, versus if I'm 90 years old and I fall and I break my hip, my reserve or my ability to compensate for that broken bone is diminished. And so that's the difference of as we age.
That's a very significant point, and it leads me to a question, because you were sharing with me the concept of life is fluid, things are going to happen in life, and I think you shared something about planning your lifestyle.
Yes, close.
Or the lifespan, yes.
And yes, exactly. And so there's a great group of geriatricians out of Northwestern in Chicago, and they did a study on this. But basically, what resulted from that study is a website, and this website is called planyourlifespan.org, and it essentially walks you through, if there was, what would you want to happen in these case scenarios, knowing that in my healthy self, I want to be able to prepare for that crisis or that emergency. And it walks you through things like, okay, which hospital am I going to want to go to? After the hospital, have I thought about if I'm going to want to get my physical therapy and occupational therapy through a home health service? Do I have people around me to help me? Do I have a spouse or family or neighbors or friends that are going to come and help me with meals or take care of things? Imagine if I broke my arm and my leg at the same time. How am I going to get up the stairs? Do I have the ability to recover in a home setting? Or do I have to think about a skilled nursing facility or a nursing home? Where are the resources? How do I learn about the nursing homes that are close to my home? So it walks you through sort of these things that typically you wouldn't encounter until you go through it.
Yeah.
But the hope is to talk about it before the disaster, before the crisis, so that you can go ahead and take I guess, figure out what matters most to you, and you have some control over that, how your care is going to be.
What I really like about that is there's an intentionality to it, and you're making those decisions thoughtfully based on when you're in a well state, your healthy self, as you said. Because often when it occurs, there's a crisis, other family members or your children are the ones having to pick up those pieces and make the best decisions. And so to be able to do that with some forethought is wonderful.
Yeah, exactly. And that's the whole goal of it. And that's what I would encourage people to go to that. But then also, I mean, in terms of just pure prevention, like how are we I don't want to fall in general. How do I help myself from falling? I would say the Y is one of these places where physical activity is important. Like we must be able to have physical exercise and strength training, gait and balance training, exercise programs that take that into account, but then also incorporate, it's not going to necessarily be CrossFit for everybody, but it's one of those things that if you have it geared towards where you are, and I believe, what is it, the Forever Fit, that's the name, right? Yeah.
Yes.
So Forever Fit is one of those places, but also understanding that if you have fallen in the past and maybe you didn't think that, oh, am I supposed to tell my doctor that I fell? Yes. If they didn't ask, absolutely say, I had a couple of falls. I'm not showing on, but having a formal physical therapist or an occupational therapist, whether it's in an outpatient gym setting or whether it's in your home as a home health, getting those evaluations are actually really quite helpful, because they can give you exercises and tips on how to avoid falling. But then also they can check your house for home safety and things like, are there rugs or that are in places that are easy to trip? Does your bathroom, is it set up that you might need to have grab bars for a little bit of safety? what kind of assistive devices might be helpful for you and your conditions. Or if you need it only in certain aspects, like if I'm going hiking or if I'm going in a specific setting, do I need to have, a cane or a stick to be able to help me with things? So that's the other piece to mobility, I'd say, is just preventing that fall from happening and being really active in your care, knowing that falls can be really detrimental to your health.
Those occupational pieces that you speak of are critical, because as we're going through our lifestyle, we don't necessarily think of ourselves as diminishing in ability. Our homes, our living environments are set up the way they're set up. And as we progress in age, we don't necessarily think of, well, I might need this, or I might need that, or I might trip over this. This could be a hazard. So that is wonderful advice. I greatly appreciate that. So we've spoken of the physical, the mental, a little bit of the emotional. What about social? How does that come into play?
Social is great because I feel like we don't talk about it a lot, right? Like you're not in, when you're in with your PCP or when you're in with your doctor, that social piece, unless you're expressing sort of dementia, depression symptoms.
Yep.
A lot of times we don't even ask about like who's your support system, who's around you, who helps you whenever you need help. So I would say, um, I would, I guess I don't know if I have a direct answer because it's almost, who is your village? How do you create
Yeah.
that environment around you? Because sometimes it's not your family. Sometimes sometimes it's your spouse and your adult children, and sometimes it is your actual family unit, but sometimes it's your neighbors or your community, someone at Starbucks, or a group that you like to do an activity with.
So important. I think about the way the world is now, where people are transitory and they moved, and not everyone as they age are close to family. Ideally, that's hopefully wonderful. But with it, I've recognized, like coming through the pandemic, that the Y played a critical role as we reopened socially, to provide connection, to provide community. And sure, the prop might be coming to a class that is for exercise, but it seemed to be the greater draw was that connection to one another and the community that is established through that.
Oh, that's perfectly said. That's exactly what I think. A lot of, even though it's a physical, you're improving your physical self, you're also improving that piece, also the community. And I mean, I'm all for class exercises. I always love to do exercise classes, and to be able to meet other people and to join and be, you said it perfectly.
So I'm going to challenge you in just a moment. Just know that that's coming. But any particular resources in the community that we should be aware of?
Yes, no, I absolutely think, the why and figuring out what resources you have in terms of physical classes is a great resource that we do actually have in our sort of, I'm going fall prevention sort of aspect of all of this, because I think healthy aging is going to look so different for so many people. But again, because I'm at a SNF and I'm on the receiving end of people who fell and had injuries, I'm going to go the fall prevention route. And so I would also say, home evaluations and really engaging with your doctor and your health system of, how can I get physical therapy or occupational therapy? If I need to have a home evaluation, take a look at my medication list. Since I work at Scripps, the Shiley Fitness Center is one of the places that does have class offerings. And so I think that's another great resource. And then I would also say, yeah, just any class that you can get out there and do, have some physical activity, balance, yoga, Pilates. The physical piece is really, really important. And I think I had one more, but it's escaping. I think the San Diego County also has some resources for seniors. And yeah, ask around, see if there's this community senior center that's around you. A lot of times for my patient population, it's adult day centers, which is, I mean, people may, sometimes you feel like, oh, it's a senior center, but it has activities and it has connections and it has, games and other things that you can potentially participate in.
Wonderful. So Dr. Deleon, here's my challenge.
Okay.
What is the vision for what does successful aging look like? So if you, based on everything you've shared, if you were to share the vision of what it would look like for us to age successfully in the realms that you spoke of.
Oh man, this is a challenge, because this is really hard to kind of sum up into one thing, because it's going to look so different, I think, for so many people. Successful aging. I think I'll say it for how I would feel for myself or for my family members.
Wonderful, wonderful.
And I would I would say successful aging is being able to age as independently as possible with as many of the things that matter most to me around me, understanding that there may be hiccups or crises that come along the way, and that's also okay, but that I want to be able to empower myself to ask the right questions and know who to go to whenever things do happen. But oh man, this is like really hard to sum up into one. But
No,
I
you're
would
doing
say
it.
being as independently as possible with resources and sort of that community around me. And just have that expectation that that is something that I want, because sometimes it doesn't exist right now and it's not on people's, it's not at the forefront of people's minds. But hey, guess what? All of it, no one is immune to aging. Every
Yes,
single person is going to age. So think of
yes.
your future self and what would you want for yourself to successfully age, and what are the pieces in the community or in your healthcare system that you would want for your aging self.
That is a wonderful challenge that you posed back to each of us. So I think you met my challenge to you very well, and now you're entrusting us to meet aging successfully. Dr. Deleon, pleasure to have time with you. Thank you for bringing this conversation forward. Truly, thank you for what you're doing for our aging population. So thank you for being with
So
us.
much. I appreciate it so much. Thanks for having me.
Most definitely. All of you, thank you for being with us. And until we're gathered again, please be well. Thank you.